Welcome to the Power of One. Along my journey of everyday life, I have the pleasure of meeting some wonderful people and people who are doing amazing things. So, someone who I just recently met, and I kind of like tracked him down and said, "Listen, I need you to be on my show because you're doing amazing things." And I think it's powerful for people who look like me to have role models and to know that the sky is the limit. So today we are going to be speaking with a very powerful individual, Dr. Orlando Kirton. How are you today?
Ms. Nelson, I am fine, and thank you for the opportunity to
You're welcome.
be on
Call
your
me
podcast.
Melanie because I'm only 21, but go ahead.
Okay, Melanie, you're
Thank
funny.
you so
Thank
much.
you.
You're welcome. Please share with the viewers your medical background and why you became the chairman of Department of Surgery for Abington Jefferson Hospital.
Sure, Melanie. Um, I am uh, a trauma surgeon, critical care surgeon. I trained, did my general surgery and residency at State University of New York in Brooklyn, New York, and then a fellowship at University of Miami, where I did trauma and critical care. I was there on faculty at the University of Miami from 1992 to 1999. And
Oh,
then I moved to the University of Connecticut at Harvard Hospital, where I was there for 15 years before moving here to Jefferson Abington Hospital, where I arrived in 2016 as the chairman of surgery. I also have an academic title, Melanie, at Thomas Jefferson University, the Sidney Kimmel Medical College, as professor of surgery in the Department of Surgery. I've been the chair of surgery here for 8.5 years.
mm,
It's something that really is continue to be a high point in my career.
I'm sure. I'm sure. So, how many years, total years of a medical school did you have to attend?
Well, it's a process, but I think Melanie, it's a process worth doing
Right.
because
Right.
it's a little delayed gratification, but at the end, you can put yourself in a position to really not only help others, but also um, embolden others,
Hmm.
to motivate others.
Right.
College for me was it was at Brown University, and I was there 4 years, but I did it in 3 years. And then I went to Harvard Medical School, and I was at Harvard Medical School for 4 years, actually 5 years, because I did an extra year to get um, um, and I graduate cum laude. So,
Mm,
so that's nine. Then I did my so that's 9 years. That's okay. It'll be 9 years there, and then I went on to do my residency training in general surgery, and that
okay.
was for 5 years. I did 2 years after that as a to do research because I wanted to go into academics. And then
Okay.
after that fellowship, when you add all those numbers together, it's before I started being an attending, um, almost 18 years.
See, Dr. Curtin, see, I know you sat in the front of your class when you was in junior high, high school, elementary. See, I sat in the back. That's why I am doing victim services. But I mean, it's great. And I'm joking, but the dedication and passion is awesome. Tell us about the role of chairman of surgery.
Sure. Um, the chairman of surgery is the penultimate leader within the Department of Surgery. So at Abington, I lead a department that has 10 divisions: orthopedics, urology,
Wow.
ear, nose, and throat, general surgery, thoracic, cardiac, podiatry. And then I have other sections of, of, of vascular surgery, foregut surgery, bariatrics, trauma, and critical care. And my role is to make sure that all these pieces work, that I'm responsible for the entire operations. That includes being responsible for the hiring of faculty, the evaluation of faculty. I'm also I oversee the quality and safety of the department. I oversee the operating room, and I oversee our general surgical residency. We have a
Mm.
training program, Melanie, where we train surgeons to be surgeons. So we
Mm.
have 31 residents in training, and we graduate 5 chief residents a year, and they may go into subspecialty fellowships, private practice, or academic practice. So it is the most highest role that you can have within an educational training and clinical department, um, is the chair of the Department of Surgery. The only thing kind of higher than that is being dean of the medical school. And the
Okay.
Department of Surgery is responsible for 60% of the revenue of any
Mm.
hospital. So we generate revenue. And finally, I'm also responsible for the patient experience, that our patients experience. All those things fall under my accountability, Melanie.
You generate revenue. So on a side note, so I'm the executive director for Northwest Victim Services, and I'm responsible for fundraisers. So we'll talk after this because I need you to help me generate some revenue for our small nonprofit. We only need about 60,000, not much at all, not much. Tell me something. What are the challenges that you face within your job?
Well, the challenges I face is the fact that medicine continues to evolve. So
Mm.
we have to continue the department to be relevant in terms of making sure that we have the training, the expertise to provide the services the community wants.
Mhm.
A lot of surgery has kind of there's a customization of it, meaning that patients want the best care and they
That's
want
right.
the best technology, and they want those delivered in with the best patient experience. So
Mhm.
my challenge is really making sure that the department um, keeps up.
Okay.
Also to make sure that the department functions as an integrated system. And that means sometimes making sure that we have the highest quality and safety, making sure that we have the highest level of professionalism, making sure that we have the best patient experience. And sometimes those are challenges
I'm
because
sure.
I have to kind of intervene sometimes to ensure that those things are delivered.
Mhm.
Those are, I would say, the challenges of the everyday. But
Okay.
it's a competitive environment,
Mm.
particularly in the Philadelphia region, and we have to focus and make sure that we don't lose market share. And
Mhm.
so those are my day-to-day worries.
How do you manage DEI in your department?
Well, diversity, equity, and inclusion, and I will use the term inclusive excellence.
Okay.
You know, sometimes diversity, equity, inclusion sometimes have become the dog whistle of people not really understanding what it means. Diversity, equity, and inclusion, or I call it inclusive excellence, is really showing what we can do as an integrated team, where everyone brings something to the table. And for me, um, an inclusive environment promotes critical thinking, it promotes open dialogue, it creates solutions, and it fosters the best environment to provide the best care. And but it has to be intentional. What I mean by that, Melanie, is that you have to, you know, excellence exists among all of us, but sometimes we don't give an opportunity to demonstrate that excellence. No one knows what excellence is out there. So when I arrived, Melanie, in the Department of Surgery here at Abington in 2016 as the chair of surgery, as challenging as incredulous as it may sound, I was the only person of color. the whole department.
Mm,
And I made it my purpose to really focus on increasing diversity within the department. I
mm,
was in my tenure brought in two wonderful African American women who now have leadership roles in my department, as well as five other women. And this has created a degree of inclusivity, but
mm.
more so in my residency training program that we have here that has been in existence for 70 years. The residency training program has never graduated an African American until my arrival.
Wow.
I arrived
Wow.
in 2016, and today here I am. It takes now remember it takes 5 years to graduate somebody from a general surgical residency, and in my time here from 2016 to now, we've graduated five African Americans
That's
from
awesome.
the general surgical program, and and by the end of this year, seven. But also, we've graduated people who have been openly LGBTQ, um, Latinx individuals, um, all exceptional people. But
Mm-hmm.
it took intentionality to make sure that those things happen in my department. And it's one of the things that I'm most proud of is how I was able, by getting into the space and
Mm-hmm.
leading in that space, getting into the space of being the chair of department, where I now have authority and accountability, I was able to make these things happen, Melanie.
That's awesome. That is awesome. So you oversee two sides, the academic department and the clinical department. Break those two down for the
Sure,
viewer.
exactly, Melanie. Great. So I'm an academic chairman of the department. And what that means is that Jefferson Abington Hospital, where I work, we have graduate medical education training programs. And to be a chairman, and there's of a department of surgery, meaning that I oversee a accreditation an accreditation council of graduate medical education, ACGME training program, which for us is general surgery. And because of that, I'm known as a chairman of the academic department. Now, on the clinical side, there's hospitals in the community that don't have a residency program, and those individuals, those hospitals, they have just a chief of service. So since I'm both an academic, I have an academic program and a clinical program. I'm both the chairman of the department and chief of surgery. So I'm chairman and surgeon in chief because of the fact that I have an academic arm for my department and I have a clinical arm. There are
And that
200.
was all those years of study and dedication.
Yes, Melanie. But in
That's
end,
awesome.
Melanie, in end, why I've stayed in academics and why this journey I have made, I consider myself lucky, fortunate
Mm-hmm.
to be able to get to this upper echelon
Mm-hmm.
surgery. I do a lot of public speaking nationally, and what is important is that people that look like you and me, as well as
Mm-hmm.
people who don't look like you and me, see people like me
Mm-hmm.
working at this high level,
Mm-hmm.
functioning at this high level, and being able to be known and for being um, effective at this high level. This is
Mm-hmm.
what this is what drives me. My ability to kind of help others that look like us and others that don't look like us to know that people of color can
Mm-hmm.
achieve the highest level and be excellent in what we do. And to me, that is the pot of gold at the end of the
It
race.
is. It is. It is. And that's why on February 25th, 2025, when I had the pleasure of meeting you, I know your family was like, this young lady is mighty bossy. Wasn't being bossy, but I knew I had to connect with you again because of the amazing work that you're doing. You know, the media portrays people that look like you and me in a bad light often. And we don't always get to tell those stories of the amazing things like people like you and me are doing. So please tell the viewers about February 25th, 2025.
So it was a great day. And I know all the chairmen of surgeries around the Philadelphia area, at Penn, at Temple, at Cooper, at Drexel, and they all at Jefferson downtown, and they all looked at this, what happened on the 25th, as really a lifetime achievement award. So
Mm,
on the 25th of February, as Melanie said, I received the greatest accolade um, that is offered by the Martin Luther King Jr. Community Benefits Committee at Jefferson Abington Hospital. This committee has been in place for 1996, and it awards to individuals or groups um, an award that's titled "Courage to Make a Difference,"
mhm,
and it moved me, and I was humbled and honored because all my life, my career life, I always wanted to make a difference. I
mm,
always wanted to be that. I always wanted to kind of use my good fortune to change others' lives, to change others' perspectives, to make people ask themselves the hard questions about whether I belong or whether people like me do belong. And to be able to be out there and say, yes, we do belong, and we will continue to belong, and we will be excellent.
mhm,
And so this is the courage. This is the courage to make a difference. So it's one of the highest awards I've received. If you come to my office, you there's no space on my wall, on my on or my mantle, because of all the things I've been awarded and recognized for. But this one, Melanie, sits at the top.
mm. That's awesome. And thank you for the invitation to come by your office. So I will definitely come by when I'm in the hospital. I will knock on you. I'm going past your secretary or administrative assistant because you know I'm already a little bossy. So say if this young lady comes and she's rocking a hat, just let her by. Her parents are good people. Just let her by. Just don't bother her. Do you have any publications?
Yes. So to get to where I am, um, I have to really be able to be prolific in the academic space in terms of research. So being an academic department of surgery not only means that we train individuals to be future surgeons, but we also have to be able to show research, to show curiosity, to be able to contribute to the body of knowledge that supports the practice of surgery. And I've, I've, I've been able to do that over the years, and it has got me into the most esteemed societies in this country in surgery, namely the American Surgical Association. Some people say it's harder to get into that organization than it is to be a chairman, the Philadelphia Academy of Surgery. And I published over 120 articles, 30 book chapters. I've presented over 100 abstracts. And in the areas of my expertise is one of trauma, critical care, surgical education, um, and ethics. Those are the things that I publish in, and I've been able to have added constructively to the surgical literature, to the trauma literature, to the critical care literature. And those things have moved me up to the rank of full professor of surgery.
Mm. That's awesome. Doc, I can imagine with probably a demanding work schedule, all of your studies, because you continue, I can tell you continue to study and you continue to grow. How has that been for your lovely wife and your amazing children? How has that been trying to manage both your work and family?
Melanie, thank you for asking that question. It is a tough balance, and um, my lovely wife and I have been married for 38 years. I have four children. Um, I would not be honest if I said it has always been easy. You know, at times I've had put my career maybe too often ahead of my family
Mm,
to get to be present and to always say yes and to never say
mhm,
no.
mhm,
But my my best good fortune is that my wife and partner is very understanding,
mhm,
and um, we work together. Uh, but it has been a challenge. I think you talk to my kids, they'll say that I'm a great dad. I try to be there for them, but it has not always been easy, and you really have
mhm,
to kind of, particularly, I would say that when I was training, um, there was no limit on the hours you spent in a hospital.
mhm,
And no one really talked about wellness. It wasn't until the late 1990s and early 2000s that we began to think about wellness and mental health and physical health. And we put a limit on the number of hours that people could work. And that has made a difference in terms of not only bringing more women into the specialty of surgery, but also keeping families together.
mhm,
So I remain together with my wife, but I'll be, I would not be honest if I said it was not challenging.
mhm. And I thank you so much for sharing that. But I could tell that your family dynamic is is you have a great support system. I could tell it's tight, which is great, and it's full of love. Because when I was sitting in my seat, I'm just waiting, and one of your daughters came down and she said, "Oh, where does the family sit? I'm Dr. Kirton's daughter." I said, "Oh, go ahead." She doesn't even know, I'm paying attention to this. And when they called your name, and when your wife went up and your children went up, but the smiles on their face, it was love. That's what it was. Nothing but pure love. And I thank you again for being honest about that. And I tell my children, anything worth having is worth working for. Nothing's going to come easy. So thank you so much for sharing that. What message do you have for that individual who is in medical school and is struggling right now but wants to become a surgeon? What positive message do you have for them?
Again, a great question because I am very involved over also with the medical school at the Cindy Kimmel Medical College. And in February, Black History Month, the medical students, the African American medical students, there's an organization called the Student National Medical Association, and there's a physician group at Jefferson where I co-chair called the Jefferson Alliance of African American Physicians, and we interface with the rest with the medical students, and they asked us to just give messages, paragraphs of motivation during the period of Black History Month. And I was quick to write something down and send it in because we need to trust our instincts and that they belong here, that they are here because of their merit. They are here because of their grit. They are here because of their excellence. And never forget that or never let anyone tell you otherwise. And you study hard, you work hard, um, and you demonstrate your excellence. And so my words is that you believe in yourself, um, and create also a support structure. No one's an island. Whenever you think you're an island, you find yourself on the wrong side of things. So those are my words of encouragement.
Doctor, I thank you so much for joining me and congratulations on your well deserved award. Thank you so much.
Thank you, Melanie. It's been wonderful speaking with you. I look forward to it. And I thank you for the opportunity.
Thank you so much for joining me today, and I hope you enjoyed this conversation. And what it means is that you too can be anything you set your mind to. It's dedication, and you have to love on yourself and encourage yourself. The sky is the limit. Peace and love.